Hello. Welcome to my channel. This is your girl Nurse Ify. Yes, today I am going to be talking about negative pressure wound therapy. Negative pressure wound therapy is one of the ways that which we use to heal wound. So negative pressure wound, it's a medical procedure in which the vacuum dressing is used to enhance or promote wound healing whether it is acute or um, chronic or wound borne. So right now, I'm going to say, like, which of the patients will be required to use a negative? Will you require to use a negative pressure wound therapy? It's going to be patient with diabetic ulcer, patient who has venous ulcer, patient with arterial ulcer, patient with pressure ulcer, patient with first or second degree burn, then patient with chronic wound, which is not healing, things like gunshot wounds, um, wounds with a large amount of drainage. Yes, patient who has wound that have a large amount of drainage. These are the patients that will need um, negative pressure wound therapy. So also patient with surgical and acute wound who is at high risk for infection. So let's go into it. So let's go over it again. The patient that is going to need negative pressure wound therapy, which otherwise also known as wound vac, it's going to be patient who has a chronic wound, patient that has diabetic ulcer, patient who has pressure ulcer, arterial ulcer, venous ulcer, surgical wound, or wound, excuse me, that has a lot of drainage coming out of it. It can be a patient who has first or second degree burn on their skin. So this procedure or this therapy is usually done either in the hospital or in the nursing home for any of these patients who has this kind of wound. Some of them are gunshot wound that has gone in. It's usually some of this quadriplegic patient who has a gunshot wound that has gone in and probably they can't sit up or they cannot stand. They are always sitting on their wheelchair or on the bed. So this wound has gone in to the towards the fat muscle to stage 4 to the bone, and it's been difficult to heal such a wound or to the subcutaneous tissues and tendon you'll be seeing out there. So these wounds are usually very difficult to heal, and for diabetic patients who they are always difficult because that sugar kind of attract infection, so always difficult for their wound to heal. So usually we put this negative pressure wound therapy for this patient. What this negative pressure wound therapy does is that it heals the wound from the inside to the outside. It heals the wound inside to the outside. So it goes in and start the healing from the inside before we can even see it from the outside. And this therapy, it's when it's done by the nurse. So when you're going to receive an order from the doctor to put in this negative pressure wound therapy, wound vac on a patient. And there is always a setting, which is usually 125 to 75 to 75 mhg. So this So it's going to give you that order to the number that is going to be set. The setting depending too on how much wound the patient have and how much the patient can tolerate it. The you before the changing of this dressing or wound, placing this wound vac, it is usually better to administer pain medication to your patient at least 30 minutes. If it's an oral pill, if it's an IV, at least 5 to 10 minutes before starting the changing of the dressing, because it is usually very painful. And these are the wounds that are really touching the tendon, touching the bone. They are really serious wounds. So before you can start this dressing or place this, make sure that you offer some pain medication to your patient. So, and this dressing usually it has a vacuum, and when you put it on, it has like a foam that you press on the dressing on that wound, and when you press it on and then put this vacuum on it, what it does is it squeezes the fluid or the drainage that is coming out of the wound into one of the boxes. I wanted to show you guys what this um, wound vac looks like, but I was unable to get a picture of it. But it usually has a drainage pump, which is very clear. You can even measure it, see how much drainage that is coming out of it. Is it just clear as this water bottle that I have? Um, so at the end of the day, when it's full, you take out the drainage and dispose it. You dispose everything both with the container. Then there is another container which it comes with the pack. They bring you an extra container. So you place that extra container and it will continue to drain to drain or to vacuum this extra drainage that is coming out of the wound. And it is usually changed most times. It's like every once a week or so. The dressing is usually changed that way. But before the dressing is changed, if you find out that the container is filled, don't hesitate to throw it away and change the container, which is called the canister. So don't hesitate to change the canister, because what happens if you don't change it, it might also be transferring the infection or the dirt that has been gotten out of the wound back into the system. So you want to change the canister and put a new canister in the machine, in the wound vac machine. So you must not wait until the day that is changed for you to change it. So if it's full, you have to change it and put a new one. But if it's not full, and then it happened that, say today, Monday, is the day that this dressing is going to be done, you have to throw away that canister and put a new canister after doing the wound dressing. You don't have to put it back. Okay? So and after this is placed, the patient doesn't feel the pain. You usually feel just a little bit of pain, a little bit of pressure. But the only time they said they said they feel pain a lot is usually while you're doing the wound dressing. But after that, they usually don't feel any pain. They can go around with this machine um, to their daily activities, wherever they are doing. It is usually not painful. And sometimes it usually have a little leak. When you have a leak, how do you know it has a leak? You will start hearing some beeping, beep, 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 and the beeping is so annoying. So what you do is that there are some tapes that come with it. It's not just an ordinary tape. So it's usually the tape that come with the machine. So cut a piece of it and place it on that area where you feel the air is coming in. Place it, and if it will stop, it's supposed to stop beeping. But in a situation where it does not stop beeping, um, try more, do some troubleshooting, cut another tape, go to another site, place it on there. You do some troubleshooting until you find a solution on how to stop the beeping. Because once it stops getting the air into the wound or into the dressing or the vacuum or the wound vac, then the beeping will cease. That is how you know the beeping will cease. But once there is air coming in, and that air, you don't want the air, because that way that shows it's not sucking the drainage out of the wound. But if there is no um, beeping of any kind, then it's sucking good. That means it's placed right. So that is one thing I really want you to know about today. And also, this is also supposed to be a sterile procedure. I've seen a lot of nurses who do this wound care in on sterile procedure. What you're doing more harm to this patient than good. If you're doing this wound in on sterile procedure, you are transferring some infection, some bacteria back into the wound. So make sure you clean your surrounding with some bleach wipe before you even start. Make sure your things are arranged in a sterile way before you even start. So that way you can be able to do a good job without running back and forth and breaking the sterile field, and thereby transferring some other unwanted bacteria into the system of that patient. And I hope this helps somebody. If you like the video, give it a thumbs up. And if you have not subscribed, subscribe, hit the subscribe button. Thank you and have a good day. Bye.